So you're recovering from surgery, and your main goal is, of course, getting back on your feet and back to your life. And that is exactly where your focus should be. In this explainer, we're going to talk about a really key part of making that recovery a safe one. It's all about understanding and preventing a rare but serious complication so you can focus on what really matters.
Okay, so the operation went great. The surgeon did their job perfectly. But now, the spotlight kind of shifts over to you. See, the recovery phase is every bit as important as the surgery itself. And being informed, well, that's your #1 tool for making sure it all goes smoothly. It's really about taking an active role in your own health. So to get a really clear picture, we're going to walk through this together. We'll start with understanding the specific risk, and then we'll trace how it all develops. After that, we'll cover the absolute must-know warning signs, how doctors diagnose it, and maybe most importantly, all the proactive steps you can take to protect yourself. So let's dive right into this idea of a hidden complication. While your incision is healing on the outside, something you can see, there are other things going on inside your body that we need to be aware of. But the key thing to remember here is that this is a manageable risk. The condition we're talking about is called a pulmonary embolism, or just PE for short. The easiest way to think about it is like a roadblock in your body. A blood clot, which usually starts way down in your leg, decides to take a trip through your bloodstream. It ends up getting stuck in an artery in your lung, and that blocks crucial blood flow.
So you might be asking, why does surgery, especially something major like a hip or knee replacement, raise this risk? Well, there are a few things at play. First, you're not moving around as much for a while, and that slows down your blood flow. The procedure itself can sometimes cause a tiny bit of injury to a vein. That combination, well, it creates the perfect storm for a clot to form, and that's what we need to actively manage.
Okay, so we know a clot can form in the leg. But how in the world does it travel all that way and become a much bigger problem up in the lung? Well, it follows a very specific path. This whole journey almost always begins with what's called a deep vein thrombosis, or DVT. This is just the medical name for that initial clot that forms in a deep vein, usually in your leg. This is ground zero for the problem. So here's the chain of events, step by step. It starts with that DVT in your leg. Then, for whatever reason, a little piece of that clot breaks off and gets into your circulation. From there, it travels up through your heart and gets pushed into the arteries of your lungs. And because those arteries get smaller and smaller, the clot eventually gets stuck, and that's it. That's the dangerous roadblock we call a pulmonary embolism.
This brings us to what I think is the most critical part of this entire conversation. Look, your medical team does everything they can to prevent this, but your most powerful tool, by far, is your own awareness. Knowing the signs and acting on them is just absolutely crucial.
Let's break this down and look at them side by side. Over on the left, you've got the signs of that initial clot, the DVT, down in your leg. We're talking swelling, pain, warmth, maybe some redness. Now look to the right. These are the signs that the clot has traveled to your lungs and caused a PE. See how the location totally shifts from the leg to the chest? Sudden shortness of breath and a sharp pain in your chest are the huge red flags here.
And this is such an important point. You absolutely cannot rely on seeing a leg symptom first. It turns out that about half of all people who get a PE never had any noticeable signs of a DVT in their leg. The very first clue that something is wrong could be those chest symptoms. And that's exactly why knowing the PE symptoms themselves is so vital.
So let's be perfectly 100% clear on this. If you experience any of these things, especially if they just come out of nowhere, this is a medical emergency. You need to call 911 or your local emergency number right away. This is not a wait-and-see kind of situation. Sudden shortness of breath or a sharp chest pain needs immediate medical help, period.
All right, so if you do experience symptoms and you get help, what happens next? I know it can be a really scary moment, but you can rest assured that there's a very clear and effective medical path to diagnose and treat a PE.
Doctors have a bunch of tools to figure out exactly what's going on. They might start with a blood test called a D-dimer, which checks for clot-forming substances. But the gold standard, the most definitive test, is a special kind of CT scan called a CTPA. It gives them a direct picture of the arteries in your lungs. They might also do an ultrasound on your legs to see if they can find the original DVT. Once a PE is confirmed, treatment starts immediately. The main tool in the toolbox is anticoagulants, which you probably know as blood thinners. Their job is to stop any new clots from forming and to keep the one that's already there from getting any bigger. This gives your body time to dissolve it naturally. Now, for very large, life-threatening clots, doctors might use powerful drugs called clot busters, and in some situations, they can even place a tiny little filter in a vein to physically catch any more clots before they can reach the lungs. And this brings us right back around to where we started. We've talked about what a PE is and how it's treated, but the absolute best-case scenario is to prevent it from ever happening in the first place. And this is where you can take a really active and powerful role in your own safe recovery.
Your prevention plan is pretty straightforward. Just follow your medical team's instructions to the letter. Get up and move as soon as they say it's okay. Even little movements like pumping your ankles in bed can make a huge difference. If they give you compression stockings or devices, use them. And if you're prescribed blood thinners, take them exactly as directed. These are simple actions, but believe me, their impact is massive.
But here's a pro tip. Prevention doesn't just start after your surgery. The absolute best time to start is actually before your operation, by having a really proactive chat with your surgeon and medical team.
These are the exact questions you should write down and ask your doctor. Ask them, what's my personal risk level? What's our specific game plan to prevent clots for me after surgery? What symptoms exactly should I be on the lookout for? And this one's huge. Who do I call if I get home and I have a concern? Get that number.
And really, that's the bottom line. You're not just a passive passenger along for the ride during your recovery. You're a vital, active, and informed member of your own healthcare team. Your awareness and your actions are absolutely central to a safe and successful outcome.
As you focus on healing, just remember that knowledge truly is power. Understanding the risks, knowing those warning signs, and partnering with your medical team, that is your best line of defense. So the only question left is, are you ready to be that key player in your own recovery?